Alright class, today we're going to talk about IV for the EMT, spiking your bag, and what all this stuff means for y'all, okay? So IVs is an AEMT or paramedic skill, but as you've seen on some of your clinicals and stuff, you can do the prep work for your AEMT or your paramedic by spiking the bag and getting things ready for your partners and stuff there. Okay? So, first thing we're going to do is we're going to talk about the different types and sizes of bags and stuff. Okay? So, you get your bag, and what do you want to look for here? What do you think? Okay, so the what?
The medication.
The medication. What is the medication, right? So, you can see it through the bag, but for clarity, we'll show this. What does this say this is? Okay. 500 milliliters of 5% dextrose. Okay? What's dextrose?
Sugar.
Sugar. Good, right? So what kind of patient might be getting this?
Diabetic patients.
Diabetic patients with low blood sugar, hypoglycemic, right? The other thing we have is, what if it just says 0.9% sodium chloride?
Salt water.
It's salt water, right? What is salt water? Why is salt water important?
That's what our body carries.
Yeah, your body made of electron.
That's what your body's made out of, right? It's called an isotonic solution. Means it's the same pH level and everything as your body. Okay, so your body's not going to reject it or anything. You can't be allergic to salt water because your body's made up out of it, right? About 70% of your body mass and minerals is water. Okay. All right. So when we get the bag, if you look over here, okay, different size bags. 1,000 milliliter, 500 milliliter, 250 milliliter, 100 milliliter. All that is broken down how many milliliters it has, right? So 1,000 milliliter bag has 1,000 increments of 1 milliliter in it. Okay? 1,000 milliliters is equal to what?
1 liter.
1 liter. Okay? 500 mLs is 0.5 liters or half a liter. 250 mLs, quarter or 0.25. And 100, which you don't see very often, especially on EMT trucks and stuff. Usually paramedics use that to mix medications in, because 100 is a nice round number that we can work with. Okay? And we can inject a medication in there. We know exactly how much of that medication is in every milliliter of that bag. So when we talk about drop sets, okay, different measurements of drop sets. If you look at the packages and stuff, you'll see a 10, a 15, maybe a 60 drop set. Okay? What does that tell you? The flow, it tells you, mother summon, see this guy.
Wow. You gotta check that out too.
Alright, so when we talk about drop sets, okay, different units of measurement for the drop set. We got 10 drop sets, we got 15 drop sets, we got 60 drop sets, and on special occasion, as you'll see, you have something called a select 3, which can go between different types of drop sets, okay? So the 10 drop set, what does that number mean?
How many drops per minute?
Almost. How many drops it takes to make a milliliter? Okay? So a 10 drop set, you're going to have big drops. Okay? 10 of those drops will equal 1 milliliter. Okay? In a 60 drop set, it takes 60 little bitty drops to make 1 milliliter. Okay? And in a 15 drop set is smaller than a 10 drop and bigger than a 60 drop, it takes 15 drops to equal 1 milliliter. Okay? So again, why is that important as an EMT? Really not so important. It's more important when we're delivering medications and stuff.
So they all get 1 milliliter.
Huh?
This all equals 1 milliliter. What's the point of having different ones?
Okay, good question. So when we think of drop sets, we think of them in two different ways. We think of micro drop sets and macro drop sets. Okay, what does micro mean? Small, and macro would be what then? Large. Okay, so when we think about micro drop sets and stuff, we think about delivering medications, and we think about doing it very accurately. Okay, so I know if I go to this 100 milliliter bag here, right, and I add a medication to it, okay, and I dilute that up, every 60 drops is going to give me 1 milliliter of what's in this bag, right? So depending on what my medication and stuff is, I may want to deliver a certain amount over 10 minutes. Say I want to deliver half a milliliter over 10 minutes, right? How many drops would that be? Half a milliliter. 30 drops, right? So I'd have to slow the drip rate really far down, so it was like one drip every, I don't know, if I want to give 30 over 10 minutes, right? Then I'd have to break it on down and go, okay, if I'm going to give 30 drops over 10 minutes, that's 3 drops per minute, 1 drop every 20 seconds. Okay? See how, and that way I could measure my medication precisely. Okay? With a 10 drop set and a 15 drop set, you can still do that, okay? But depending on how much you're trying to deliver over a period of time, it may not be as easy to do, okay? 10 drop sets, pretty easy if you're giving a lot of medication in a short period of time. 60 drop sets, more for measuring really accurate results, okay? So when we think about that, it's kind of an old EMS thing where we talk about medical patients get 60 drop sets, and trauma patients, because usually trauma patients need fluid, right, get the 10 drop sets, okay? Because we're not really interested in accurately measuring how much fluid they need. We can look at the side of the bag and say, okay, it went from 500 to 400, I just gave them 100 milliliters, right? It went from 500 to 300, I just gave them 200 milliliters, so forth and so on. Alright, so when we talk about IV catheters, what is an IV catheter, right? Well, first thing is it's a needle, because we need that to puncture the skin in the vein, right? Around that needle, though, you'll see a clear plastic tube, okay? That is where the fluid is going to go through, okay? The needle is just there to make the hole, okay? Once we've made the hole, the only thing that stays in the body is that clear plastic tube, okay? That attaches to our drip set, and then we can get fluids to the patient, okay? So different catheters and stuff have different buttons and that kind of thing. There's some that self-retract, some that you have to pull back. The basics of it, though, are your needle, where you hold it. Up here, you'll see a flash chamber, okay? And so when we dip the needle into the skin and into the vein, okay, blood will flow up the needle, in through the catheter and stuff, and we'll get flash that tells us we're in there, okay? That's why we look for the flash chamber, okay? After we've got the venipuncture started, right, then we advance that tube. The tube is what actually goes down into the vein, right, and we've got a cap on it here at the end, right? That's where we hook our fluids to, okay? And that tube is nice and bendable, just like our veins and stuff, right? So we can draw the fluid through there, and it goes into the body. If we're not paying attention, okay, if we put in the needle and don't watch what we're doing, don't watch flash chamber and that kind of thing, we can actually over penetrate, go through the vein, and then we get edema and stuff and swelling from where the fluid's not going into the vein anymore. It's going underneath the skin and into the tissue. Okay? So that's how an AEMT does it. That's what they're looking for when you all are helping them out and stuff. If you see the site around the vena pectoris swelling, turning red, that kind of thing, you might want to bring it to your AEMT or paramedic's attention so that they can check it to make sure it's right. Okay? So we talked about the different drip sets. We talked about the needles. Does size matter on the needles?
Yes.
Okay, it can. It absolutely can. All right? So just like in electrical wiring for your house and that kind of thing, the gauges run the opposite direction. Okay? So the bigger the gauge, the lower the number. Okay? So 14 gauge is about as big as you'll ever see on an ambulance. Okay? Usually where you see a 14 gauge needle and stuff is where we do needle decompression for a chest, right? They'll use a 14 all the way up to a 10 gauge needle, which is pretty stout. Okay? And then going on down, increments of about 2 to 24, okay? 22s and 24s, elderly patients with a lot of little broken veins and that kind of thing, or children, okay, is where we'll use those 22s and 24s for, okay? The other time that it matters is depending on how much fluid you want to push, okay? Just like a garden hose, right? If I wanted to drink a McDonald's Coke really fast, right? And I took a garden hose, put it to the top, how much of that could I suck up at one time? A whole bunch, right? If I used a little coffee straw, right, like those ones they use to stir it up with, it's got just a little bitty hole in it, and tried to suck all the Coke up through that, it wouldn't come out very fast, right? I'd be for over and over, keep trying to go, right? So the size of the needle makes a difference when we talk about how much fluid we want to push over a period of time. Okay? I can push fluid a lot faster through a 14 gauge than I can a 22 gauge. Okay, does that make sense? So our trauma patients, again, maybe we want to use a 10 drop set and a 16 or an 18 gauge needle, right, to be able to deliver fluids faster. Does that make sense? All right. Now when we get to spiking the bag, okay? Spiking the bag is really not that hard. What we want to do, first off, okay, is we're going to check our bag, okay? We're going to look for medication. And if you look on this, it says we got 5% dextrose, okay, which means we got some sugar, okay? And usually what we'll see for most of our EMS calls and stuff, it'll say 0.9% sodium chloride. 0.9% sodium chloride is what we call normal saline, okay? And you'll see it abbreviated as NS, okay? Normal saline, okay? So to spike the bag, first thing we want to do is make sure we have the right bag, right medication for our patient. Just like the 6 rights for medication administration, right? Right patient, right drug, right dose, right route, right time, and right documentation. When we're looking at this, we want to make sure it's the right medication we want to give them, be it normal saline or dextrose or whatever it is, okay? We want to make sure we got enough to give however much we want to give, all right? Like I said, bags come in different sizes and that kind of deal, okay? We want to check the expiration date, which is usually up in one of the corners, or sometimes you'll see it on the side, okay? This one here is a nice training bag. It expired in August of 2013, so it's not that old, only 8 or 9 years, okay? But then we want to look at it, hold it up to the light, and make sure that it's clear, and see if it has any floaties or something in it, right? If it does, we're not going to use that bag, okay? All right, so for argument's sake, we're going to say this is a good bag, right date, it's got good color and no floaties in it, okay? And instead of it being 5% dextrose, it is what? 0.9% sodium chloride, which is what?
Salt water.
Or, what's the other thing we call it?
Saline, normal saline.
Normal saline, right? Alright, so when we get the bag, different bags will show, they always have 2 ports down here on the bottom, okay? One usually has a white or a rubber band type color port. That's for injection, going into the bag, okay? Paramedics and nurses and stuff use when they're trying to mix a medication with the normal saline or whatever it is, okay? So they would put a needle in there with the medication and inject it in the bag so that they would get a good mix, okay? The other port, this is where you're spiking from. Usually it's a little bit longer, not always. You just know it'll be covered with either a blue tab so that you can find it easy, or something that makes it different, okay? So what we're going to do is we're just going to pop that off, okay? That comes off, goes in the trash can. We're going to pull out our drip set, depending on what size we need. If you look at this, I can tell this is a 60 drip set. I don't have the package for it, but how do I know it's a 60 drip set?
The needle, that's inside.
There's a little needle inside, right? Because that's got to make that large diameter pipe smaller to break it down into 60 drops, right? So there's a little needle in here, so I can tell this is a 60 drop set, okay? So I'm going to hold the bag and be very careful. This, and you don't want to touch it with your fingers and stuff, because you're going to, whatever's on your fingers is not going in the bag, right? But just to show you, this is very sharp, okay? So if you're bumping around and jumping around kind of thing, you can poke yourself with this, okay? Just like a needle, okay? So what we're going to do is we're going to put that into our bag, okay? And we're going to use a little bit of pressure and a twisting motion, okay? Until that pops right down in there, okay? This little wheel cog right here, okay? This controls our flow rate, okay? If you're not getting any flow, it could be because your wheel is all the way down here at the end. And when you put it all the way down at the end, that pinches the tube off, just like if you were to take and pinch it between your fingers, okay? So we make sure it's open. On this one here, I'm going to take and I'm going to squeeze this up a little bit. I'm going to close my wheel off so we fill the drip chamber. And this is going to take just a minute because it's a little 60 drop set. So give it just a couple squeezes so it gets about half full. Okay? And then I would open up my line, make sure not to drag this on the ground or dangle it, that kind of thing. Alright? Open this all the way up, and we're going to see it dripping from up here, and we're going to see our bubbles start to move through the line. Okay? See the bubbles moving through? I don't know if you can see that on the screen. Anyway, bubbles are moving through. We watch them. We're going to waste this into the trash can or whatever outside. Alright, once we get all the bubbles through, then we're going to clamp it off. Okay? And then on the end of the IV, where they started the IV and they flushed it, or if they haven't flushed it, there should be an INT cap, which is a little white cap Nope, not that one. Where's the catheter at? There we go. Alright, so this is the catheter. Again, there's no needle in here now. Okay, so this is what goes into the vein. Okay, you see it's nice and bendable and stuff. Alright, that's what stays in the vein. This little greenish type cap would be what was left on the skin, and then the white piece right here at the end is your EMT cap. Okay, and it's just something to go in between the catheter and the bag. So you're going to push that in, and as you push, you'll feel a little spring in there that opens up this valve to close your twist cap on. And then if we open this back up, this is how it'd be flowing into the patient. Okay? So nice and easy. It's not hard. It's just a matter of knowing what you're talking about. Okay? When your paramedic asks you to get them a 500 ml bag of normal saline, right? What size bag are you going to go for here? He says get a 500 ml, right? This one here. And you're going to make sure that it says what? 0.9% sodium chloride on it, right? If he tells you to get me 5% dextrose, right? You're going to do the same thing. You're going to look and see 5% dextrose on the bag, right? Whatever size that your paramedic or EMT needs, and that's what you're going to prepare for. Okay? And that's how you set it up, minus the piece down here at the end, which would be put in place by your EMT or paramedic. Alright? Any questions? Pretty straightforward, right? Alright. So, spike in the bag, drip chamber, right? Your tubing. Now, what's the difference between a 10 drip set and a 60 drip set?
The 10 work, it's bigger drops.
Bigger drops. So how many drops does it take to make a milliliter? 10 drops to make a milliliter, right? Now, this is a 60 drop set, alright? Is it as fast as putting in a 10 drop set?
No, but you can.
Smaller drips.
Okay? It's not the size of the drip that matters, okay? Remember, when we're talking about speed of how to deliver this, what matters?
Needle.
Size of the needle and stuff, right? Because I can put some pressure behind this bag right here, and I can squeeze it out dang near as fast as I can with a 10 drop set into the same size needle, right? Now, the bigger the needle, the less pressure I have to put, and the faster it's going to push anyway, because bigger straw, right? Everybody good with that? Because that's always a test question, especially when you get to AEMT and paramedic. How would you make a drip faster? How would you push more fluids over less time, kind of thing? And again, it's size of the vein, size of the catheter, okay? Because smaller catheter, the less you're going to be able to push through there, okay?